All right, everybody, welcome to The Secret Cocktail. Thank you so much for joining us. I have been waiting for this moment because you all know I feel so strongly about nurse aid education, professionalism, career development, you name it, I'm your girl for it. So I'm so proud to say that I have NAHCA with us today, Lisa, who is the Director of Sales and Marketing with NAHCA. Now, you may be asking yourself, who exactly is NAHCA? Some of you may have heard of NAHCA, some of you may have not. I am not the expert in all things NAHCA, so I'm going to let Lisa introduce NAHCA and tell you a little bit about NAHCA, what it is, and how you too can be involved. Lisa, welcome.
Thank you. Nice to be with you, Victoria.
Yeah, thank you so much for coming onto this platform and sharing what it is that NAHCA does with everyone. Talk to us a little bit about NAHCA, the mission, what it stands for. What is NAHCA?
Okay, what is NAHCA? NAHCA is the only national association for certified nursing assistants. Now, that also encompasses a few other people like home health aides or medication techs, that sort of thing. Anybody that's that frontline caregiver that really is hands-on with the patients, that's who we service.
Okay,
So,
awesome.
we were found, sorry.
No, go ahead. That's what I was going to ask you. Whatever you're ready to say is what I was going to ask.
Okay. We were founded in 1995 by two ladies, Lori Porter and Lisa Sweet. Lori is our face of the company. She is a keynote speaker now, and Lisa Sweet is an RN, and so she does a lot of our education. Mm-hmm. They founded the organization because they both had started out as CNAs in their careers, mm-hmm. and knew how important they were to the entire organization and to the patient especially. So they had three pillars that they built the company on. They wanted to enhance the quality of life for our frail and disabled individuals. Mm-hmm. They wanted to enhance the professional standing of CNAs. They believe it should not be a job, it should be a career.
Yes.
Yes. And so there are four pillars under that. So that's through recognition, education, advocacy, and motivation. So those are the things we focus on. So, and then, of course, we wanted to build relationships within the healthcare industry on a professional level so that we could give CNAs a national voice.
Okay, awesome. So tell me, what again does NAHCA stand for?
National Association of Healthcare Assistants.
Perfect. Okay, so who out there knew that NAHCA existed? Please let us know. Had you heard of NAHCA before now? Is this new to you? Where are you at with that? So I love the reason and the pillars behind why NAHCA was formed. And I think that especially all of us who are nursing assistants, as well as those who are nurses, believe in those exact same things you're stating, the reason why the organization was developed. I had a CNA reach out to me yesterday. She was actually interested in starting a nurse aid training program. But the first thing she said was, I want to make sure that all nurse aides take this job seriously, that they understand the seriousness behind this certification. And she was so strong about her words and how she felt about it. And it was so funny because that's when I felt when I went to you guys' conference, when I first met you guys. Mm-hmm. So if you don't mind, that's kind of a segue I didn't even know I was going to go into. But can you talk a little bit about the different types of programming that you put on and the different things that you do to encourage professionalism and all these different things for nurse aides?
Absolutely. So we've actually got a lot of new things in the works right now. We are just launching, hopefully this week, a brand new membership platform, which is going to be a lot more interactive for our members. It will actually build a directory in the system, and you can put photos in there, you can put videos in there. You can put as much or as little information as you want that the other members can see in a secure place. Mm-hmm. But it also provides private messaging in there. So you know you're really talking to the person, that you want to talk to. It also is going to have wonderful new professional and personal forums that we're really excited about. We have so many questions and things we like to get out there. And we use Facebook a lot, but we really think these forums will be great because it will be CNA specific.
Yeah, and more private.
Right. And then our blog is being revamped, and we're going to have a lot of really cool guest writers on our blog. So I'm excited about that. Um, we have a new job board that we've just initiated, very new. What I really like about that for the CNAs is that, and it was important to me when we built it, that we had a resume builder in it. Because so many CNAs, maybe not the ones that go to your schools, but they don't learn how to necessarily build an effective resume.
Yeah.
And in today's environment, so many more long-term care settings are starting to implement career ladders. And so even if you want to stay within the same organization, you need a really good resume for your career ladder. And so that gives them the ability to do multiple resumes and save them in there.
So let's talk, like, the career building aspect is huge. And a lot of people don't even realize that there is a career ladder within the CNA brim. I know one CNA that graduated from my school, she ended up working for a home health organization. And within, I think, like 6 to 8 months, she did so good, they promoted her. And so she ended up moving up to being the staffing coordinator for the company.
Amazing.
So there's different types of career ladders, if you will, that definitely they can move it up in, but you're right. They have to know how to be able to prepare themselves for that.
Absolutely. And it's really important to us to provide quality education to CNAs. So of course, in your school, you're teaching them the basics of the job, but as anybody that works in healthcare knows, there is always continuing education. And I think the hungrier you are for knowledge, the better you're going to do in your career.
Yes.
If you're constantly learning, constantly evolving,
because you're
going to
engaged.
be exactly. That's kind of the whole point. You want to be engaged. You want to be your best self. You know, I think that's part of just growing as a human. So I think that's really important.
How long have you guys been in operation? How long has NAHCA been in operation?
1995. So this would have been our 26th year for conference that we obviously did not get to have, unfortunately, but we are looking forward to next year. So
talk a little bit about the conference that you guys hold annually.
Well, and you got to come to our last one.
It was so much fun, but I'll let you talk first.
So we get together, we move around the country. It's 3 days. It's in the summertime, usually in late July, early August. And Victoria came to Little Rock when we were there. We do lots of education. We have lots of speakers, but we have a lot of fun. We have breakout sessions. We have our pro shop. We play games together. This year we were going to have CNA Olympics, but darn, we didn't get to do that. Yeah. But we always have a good time. We've marched on Washington. We've taken cruises. We just do all kinds of fun things. And then on the last night, that is the big event. We have the Key to Quality Awards, and that's televised, and it's red carpet. It's like the Emmys. Everybody walks the red carpet, and Dane is our newscaster for the organization. He does long-term care news on CNA TV. He's up there with his microphone talking about everybody's clothes and how nice they look, and if they're up for an award. And then everybody goes in, and we have 12 awards we give out. You're nominated by your employer usually, and it's a big deal. It's a national award.
Yes.
So 12 people get these national awards. They come up on stage, they have to do a little acceptance speech and get their trophies and stuff. And so we have a wonderful time at Key to Quality Awards. So if you go to CNA TV on YouTube, you can get there from our website or just by going to YouTube and subscribing. You can go type in CNA Fest, and you can go back and see lots of videos.
All the different ones. Yeah. So, and just to give you guys some perspective, like the CNA Fest that I went to, first of all, I was blown away at the level of engagement from the nurse aides. Like, they were speakers. They were killing it. It was awesome. The vibe was awesome. The camaraderie was awesome. There was, after the conferences, after the meetings and things, then they went and did fun things. So we went and did zip lining. We had, like little, what was it? Like a poolside jam. Like we did all types of things. There was kayaking. You name it. So it was like a getaway. And correct me if I'm wrong, but NAHCA is a nonprofit organization, correct? So So you guys out there, you can donate to the cause. You can sponsor a nurse aide to these events. So the Secret Cocktail actually sponsored a nurse, a nurse aide to go to the event. So you can sponsor someone. Nursing homes, if you're watching this, you can sponsor and send one of your employees. It is huge. It's a big deal, and it really does something huge for their self-esteem, which they deserve, in their profession. This is a hard profession. Healthcare, taking care of someone's daily needs every day and putting them almost before yourself, because we know that's what they do. That is tiring. And so they deserve that credit. They deserve that weekend of bliss. So I think that that's awesome that you guys have that.
Yeah, and we really try to keep the cost down because we know CNAs aren't the best paid individuals in the facilities. So people that are members actually get a discounted price over the general public. And once you get to the event, whether you fly in or drive in or walk in, once you get there, you don't have any other expenses unless you want to spend money in the pro shop. We give you 3 meals a day. We give you room and board. We give you snacks. We have cocktail parties with little drinks. We have all of that. All of that is included with the registration price.
Yes, yes, and it is definitely reasonable. So, but they can keep it reasonable because people like us are going to take the time and donate to the cause. We are in this profession because we want top-notch, high-quality nurse aides, and so we need to show that by investing and giving back to this profession in this way. And I think NAHCA is a wonderful way to do it. I'm telling you right now, your dollars are very well spent because the level of just the level of that entire conference was beautiful. It was beautiful.
Thank you. You're so
Yeah,
kind.
definitely.
Yeah.
So talk to us a little bit about, because I heard you say something about CNA TV. So can you talk to everyone a little bit about what is CNA TV? What is that?
CNA TV is our own TV station we produce, and we have a studio and we produce it ourselves. It's on YouTube. If you go to our website, which is NAHCA, CNA.org, NAHCA, CNA.org, there's a link there. You can go and we've got we've got at least 1,000 different shows on there. We've got long-term care news. We have CNA Heroes, which is a tearjerker. You have to have your Kleenex before you sit down to watch it. It is just gorgeous. Lisa Sweet, who is one of our co-founders, does that show, and she highlights often CNAs that we have lost or have given their lives in service to their profession, and or just that have done extraordinary things above and beyond, so it's a gorgeous show. We have the Gentleman Poet, who is just a beautiful older gentleman that is a storyteller. You saw him at CNA Fest.
Yes.
And then we have some feel good shows too, like my show, Good Vibes. It's been on hiatus, but Victoria has been on that before.
Yes.
And that's about how to take care of yourself so you can take care of everybody else. So we have lots of good content on there.
Awesome. Okay, so here's my question for you.
Okay.
Tell me a little bit about like some CNA success stories or some CNAs that have been involved with NAHCA and how that has propelled them in life, in community, and profession, or whatever.
Well, we've got a couple of different things. We have a mutual acquaintance before we even knew each other, Celeste. I'll just say her first name. Yeah. So Celeste is actually one of our newest board members. Our board is made up entirely of CNAs.
Yes. Yes.
And so we had 7 and we're expanding to 11. So we've just initiated 3 and Celeste was one of them. Our board often does panels, research panels with different organizations. They test products. Of course, they give us feedback on our questions. What do you think about CNA Fest? They help us plan it and everything. And Celeste her first one was so good. And it was with Harvard, Aradine, that is part of Harvard. They reached out to her individually and asked her to speak on their conference.
Awesome.
So, that's pretty amazing.
That is. That's
speak at a Harvard event.
Yeah.
So those kind of things. So another thing that is really wonderful about NAHCA is our preceptor program, which comes back to that education. We have the preceptor program and the geriatric care specialist course. Those are both very advanced courses. The preceptor, though, is the principle is it's your superstar CNAs. It's the ones you want training your new people. It's not necessarily the person that's been there the longest. It's the best, you know?
Yeah.
And we put them through a 10 module education, and it's interactive with us. They do a module, they have to write an essay. We give them feedback on the essay, and we have to do that before they move on to the next one. But we have been proud to initiate over 5,000 CNAs in the 25 years we've been here.
Wow.
So we have over 5,000 preceptors out there that went through the NAHCA program and that are all over the country. So we're very proud of that. The geriatric care specialist course, we are actually revamping, and it should be up in a week or so, but it is our most challenging education. And it is not for the faint of heart, but you come out with some amazing skills. So
now, how long is a program like that?
Well, it can really be as quick or as slow as you want it to be.
Okay.
The preceptor program, you could probably realistically get through in about 6 weeks if you were really investing your time into responses, you know, giving us really in-depth responses to the questions. You could do it a lot faster. I just think you would get more out of it if you spread it out a little bit. The geriatric care specialist course is much more challenging even than the preceptor course, and that might take a little longer.
Okay. All right. So are these courses, do they have to pay for these courses? Are they sponsored? How does that work?
It can be either way. They can pay for them themselves. Some of our programs, which is something we wanted to talk about with the schools, some of our programs include some of that education as the package price, and those can be distributed to whoever the administrator or teacher feels would benefit from it.
Okay, so this is a program that not only NAHCA, that students would do with NAHCA, but it could be integrated into the educational process early on when they first go through training. Is that what you're saying?
Absolutely.
Oh, okay, okay. So now I'm interested to know, what does that look like? How does that look like? Explain that.
Well, you and I have talked about this a couple of times, and it's still in its infancy, but I think we're close to having it figured out.
Okay.
I think we should implement programs for the schools where every class, the teacher would basically enroll every student in that class in NAHCA, and they would have all the basic items we've talked about, all the benefits like the drug program that's free, like discounted hotel rates, the camaraderie with everybody. All of that is just part of the basic membership. But in our corporate memberships, we also have things like swag bags we send out to the administrators, teachers, and that gives them gifts that they can send out to whoever they want.
Yeah.
It includes thank you notes to the CNAs. It includes lots of little things that are all CNA related that they can share.
Okay. All right. Nice.
Plus the education. We can also include education.
Right. So is this a membership that the school would be purchasing, or is it like a per student membership? What does that look like?
I think it should be more like our champion membership, which would be a facility type membership, because then you could get the gifts to add out. It would include some of the education. It would be a little more in depth than the individual.
Okay.
We could certainly do either way, but I think there are ways we can make that work so that it's very, very cost effective for the school, and if they need to pass that on to their students, it wouldn't cost their students as much as an individual membership.
Got you. Now, let me ask this, because if I was an instructor who has a current class, my first question would be, well, with let's say the geriatric, you said the geriatric course?
Care specialist.
There we go. Geriatric care specialist course. How can the student position themselves with that on their resume? What does that look like?
It is not a nationally accredited program, but on a resume, if you show you're part of a national association
that
is recognized, and that you've gone through their education, and say, I have passed these courses in their educational module, then that's going to give them credibility, and it's going to show their employer that they're a go-getter, that they want to learn, that they're eager. And those are the kind of people you want to hire.
Right. So that they're going above and beyond, which actually for any CNA who's watching or any instructor, the question is, how can CNAs own their profession, right?
Mm.
How can they own their profession? How can they become active? And that's one example of that, right?
Mm-hmm. Absolutely.
Yeah.
Yeah.
How else would you say?
Um, I think if not only being involved in that national organization, but by being engaged with it, taking part in those forums, even maybe offering to write a blog,
Hmm.
this is my experience. We are often asked for our membership to give advice or interviews or opinions on things.
Hmm.
If you join and in the membership you say, yes, I'm open to doing this, then we're going to reach out to you and say, would you like to sit on this panel like Celeste did? Would you like to do this? Would you like to do that? Every one of those things you do, you can put on your resume and say, I did this for this national association.
Right. Yeah, I mean, something as simple as now I'm thinking about products, but let's say there was like a new gate belt that was coming out, right? Well,
Mm-hmm.
who better to know if this gate belt is going to be really effective from the user standpoint than to ask the CNA. And
Mm-hmm.
so giving them the ability to be the first to try something out and give feedback, if they can
Absolutely.
build that product off of their feedback. That's awesome. That is an
Mm-hmm.
awesome resume. Yeah, you're right. Awesome thing to put on your resume. All right. So tell us a little bit more about, you know, what NAHCA is planning on doing in the future. Like where can people find NAHCA? What can they do to connect with you? And what are some different things you'll be doing in the future?
Well, I talked a little bit about the new membership portal. So
Hmm.
as soon as that's up, I'm really anxious for everyone to get involved with that. We had when COVID first started, we knew we wanted to help CNAs that were struggling financially, and we developed a relief fund. We were able to help over 10,000 people
Mm.
with everything from rent to gas to whatever their needs were. Um, we were fortunate that Care International reached out to us and partnered with us. That's a big company. They're the same people that do like Save the Children. I
Mm.
mean, all they do is get with these corporate people and try to get donations for different things.
Yeah.
And we sent them a list of 10,000 people that applied. We had 20,000 apply. We sent them a list of 10,000 and they gave out gift cards. MasterCard donated $2 million to them for that. And they gave out
Wow.
10,000 gift cards. So we are offering all of those people a free membership because we weren't able to help everybody. So we thought we can give them a year free membership and that might help them,
Yeah.
their
But
career. So.
do you see, guys, why being part of professional organizations are key? Like you wouldn't, for those of you who are CNAs, like you didn't even know about this because you're not a part of NAHCA, right? So, once you get more involved, you learn and you know about these different opportunities that are out here. And it is up to us instructors to make sure that we are providing our CNAs with these tools and resources because they don't know, they're new to the profession. When they're in your arms, they're just babies learning their profession. And so it is up to us to make sure that they understand what they need to do to recertify, what they need to do to stay within their scope of practice, and what they need to do to become professionally active in their profession.
Mm-hmm.
They are looking to us to give them all of that knowledge. And so a professional organization like NAHCA is going to help tremendously. I'm so thankful for NAHCA. I'm so excited about the work that you guys are doing. I've learned a lot right here on this with this conversation. We haven't had a chance to connect in a while. So that that um that 10,000 people that were able to get assistance during COVID, that's huge.
It is. It is. Another thing we're doing, Lori Porter, that I talked about earlier, one of our co-founders, was also on the White House's, now I never say this right, the National Commission on Long-Term Care
Yeah.
Coronavirus Task Force, whatever it was.
Okay.
Yeah. And Lori was on that. And she really advocated for you guys. I mean, it was amazing. She advocated for a national database. Victoria and I have talked about that before and
Mhm.
how important that is. So we're That did make it in the final report to the White House. So we're
Mhm.
hoping maybe that will come to fruition. And we're also working on a national campaign to recruit CNAs. So
Okay.
I'm excited about that. And on October the 20th, we are hosting a CNA summit. Now, this would not necessarily be for CNAs. It would be for their administration or their teachers.
Okay.
We're going to have a panel of 9 CNAs, and we're going to have a very frank discussion
Okay.
about how their jobs have been during coronavirus, how it could be improved, how do we make things better, what have we done right. We're going to talk about all those things. We're going to have a professor from Harvard speaking. We're going to have people from the CDC speaking. It's going to be a big deal. It's going to be life-changing to a lot of people, I
Yeah.
truly believe. And so we just launched that today, so people can register for that, or they can become a sponsor for it also. So I will share those links with you, Victoria, after we're
Okay.
off here, and maybe you can share them with your membership.
So tell us again what day?
October 20th.
October 20th. Okay, and just so I make sure I understand correctly,
Mm-hmm.
so October 20th, there's going to be a summit. Is that what you called it?
A CNA summit
Mhm.
virtually.
Okay.
Mm-hmm.
And so there's going to be different speakers talking about how coronavirus and everything's been going, and how the life of the CNAs and their career, how it's been working for them, what's working and what isn't.
Yes.
Got it. Okay. And so you're right. This is a good discussion. These are the types of discussions that help put together change. And one thing that I know for us on our end from the instructor side is that, okay, so we know there's a national shortage of CNAs, right? We know
Mm-hmm.
this. Okay, there's nothing new, and in the next 20 years, it's going to be so horrible that we're not even prepared for how horrible it's going to be if we don't fill this gap.
Yes.
Would you agree?
Absolutely.
Okay, so one of the biggest barriers to us in providing education is that the Oprah Act states that in order to have a program, a nurse aid training program, you have to have a RN that has 2 years of experience, and one of those must be in long-term care.
Yes.
That is a huge barrier because most RNs go straight to hospital and never touch a long-term care facility ever.
Right. Right.
So we have been trying to figure out for the longest, how can we advocate to change that small little portion of this regulation? And also, in many states, they're prohibiting LPNs from teaching because the regulations are so vague. It just says nurses. It does not say
Mm-hmm.
RN versus LPN. So some states are not counting the LPN as a nurse, which they are.
Absolutely.
So those are two big problems with Oprah that if we could all come together to do something to change that, we could get more nurse aides trained
Mm-hmm.
and get them prepared for what's to come.
And we absolutely share the same opinion on that. Lisa Sweet, who is our RN, has always said to me, there's no other nursing profession that somebody above them in degree is the one that has to teach them.
Right,
So why can't a seasoned CNA teach other CNAs?
right.
So that's something she very much advocates for, which that comes back to that national registry. Every state has different requirements. We want a national registry that says everybody has the same requirements, just like RNs do, just like
Mhm.
LPNs do. So that's the goal. And that's something we're really working on that got to the White House. Now, what will happen there, we do not know.
Yeah. You can
You
only do your best to try to get it there.
That's right. But we got our voice out. So we
Mhm.
told them that's what was needed. And part of what we said about the National Registry is from state to state, there's no continuity, not only in the education side of it, but in, say, abuse. I mean, I hate to talk
Mhm.
about that, but if
Yeah.
somebody does something bad in one state, they can go to another state and work.
Yeah, now that's true. And the nurse aid training programs, not all states require them to look to see in other states, if there's any type of complaint against them, or even
Mm-hmm.
check,
Mm-hmm.
period. Yeah.
So we really are advocating for that national registry, and we think that might come to fruition. And if that does, that's in the national recruitment effort, that gives us a platform to say, this is how you get more. This is how you get more CNAs, is by changing the standards for the teachers.
Yeah,
Mm-hmm.
definitely. Because the standards for the instructors, it is just ridiculous. And it almost, I mean, it's non-existent. You know, like you're going to max out is the point. You're going to
Yes,
max out of RNs that have the long-term care experience, and then what?
absolutely.
Yeah.
Absolutely.
Yeah.
So we're on the same page there. And those are the kind of things that NAHCA advocates for. So if you want to know what we stand for, that's one of them.
Yeah. Okay. Good to know. Well, is there anything else that I didn't touch, or anything that you really want to share with everyone
I
that
think,
before we go?
no, I think we covered a whole lot. So I think we're in good shape. But if anybody has any questions at all, please feel free to reach out to me. You can always do info@nahcacna.org as a general email. It still comes to me. Victoria knows how to get a hold of me. So, I mean, if you guys want to talk to me about what you can do for your school, how we can get you involved, we'll get you information and we'll figure something out that works for you.
Yeah, and again, I'm going to highly suggest everyone get involved. I'm telling you, every week I get on phone calls with people wanting to start schools, and I ask them all, what is your reason for starting a school? And they all have the exact same sentiment. I want to increase the quality of care. I was once a CNA. I want to give back to the profession. You know, I hear these things all the time. This is how you do that. You get involved. You teach the CNAs that you're training. You teach them how to get involved, and so on. So this is the direction to do it. NAHCA is the only nationally recognized organization for nurse aides. We have to support them, okay? All right, well, thank you, Lisa, so much for joining. I'll make sure that I put all of the links down in the comment section for you guys. If this was so helpful to you, please click the share button, tag a CNA that you love and that you know is awesome at their job. Let them know we love them, we're rooting for them, we are here for them, and they need to join NAHCA as well. Sponsor a CNA to join NAHCA, why not?
Absolutely.
Yeah. All right, Lisa, thank you so much. You have a good one.
Thank you.